Well, good afternoon, depending on where you live, and good morning, depending on where you live. Thank you, everybody on the Healthy Counties Committee for being here today. I think I've met most of you before at different NACo events, but if I haven't, happy to introduce myself. I'm Phyllis Randall. I'm the chair at large of Loudoun County. In addition, I'm so pleased this year to be named the chair of the Healthy Counties Advisory Committee. A little bit about myself. I am by profession a mental health therapist with an emphasis on substance dependence and eating disorders. I have worked most of my career with incarcerated populations at the juvenile and adult level and in incarcerated settings, so with the offender populations. I live in Loudoun County, Virginia. Before becoming chair of the county, which I did that about 6 years ago, I've been in office for about 6 years now. In addition to being a chair of the county and a wife and a mother of the two most wonderful children in the world ever born on earth, that's my story. I'm sticking to it. I was also chair of Virginia's Fair Housing Board under two separate governors, Governor Terry McAuliffe and Governor Bob McDonald, so one Republican and one Democrat, and chair of Virginia's State Board of Corrections under Governor Terry McAuliffe. And so I've been really involved in all things of health, full body health, for many years, and I'm thrilled to be here today. I do want to just take a second and introduce all the vice chairs of the Healthy Counties community that we're going to talk to today, because we had a meeting last month and set the agenda for the year, and I'm really excited about the agenda. I'll talk about that in a little while, but first I just want to go through and just real quickly introduce the vice chairs of the Healthy Counties Advisory Board. We have my friend Marianne Borgensen from Douglas County, Nebraska. We have Commissioner Dennis Deere from Cook County, Illinois. Commissioner Natalie Hall, who I see all the time now, from Fulton County, Georgia. County Treasurer Jennifer Henderson from Schleicher County, Texas. And Jennifer, I hope I said your county right. I think I got that right. Commissioner Brenda Howerton from Durham County, North Carolina. Commissioner Sig Hutchison will be joining us a little later today. He's running a little late. He's from Wake County, North Carolina. Marnie Cool, the Director of Health and Human Services in Washington County, Oregon. Nick Mancione, Director of Health and Human Services in San Diego County, California, where we just all were. It was beautiful, fantastic. Nick, thank you for your hospitality there. It was fantastic. Carol Morley, the Public Health Director in the Idaho North Central District of Nez Perce County, Idaho. Patricia O'Bannon, Tuckahoe District Supervisor from Henrico County, Virginia, so right down the street from me. Kenneth Wilson, the County Administrator in Franklin County, Ohio. And finally, our Corporate Vice Chair, Carol Reynolds from NetSmart. And Carol, thank you so much. I want to thank all the vice chairs, and I want to thank the Healthy County sponsors. We cannot do this without our sponsors. And some of our sponsors are Aetna, United Healthcare, Esri, who are both in California and in Loudoun County, Masimo, United Optimum Health Group, and NetSmart Technology. So we really appreciate our corporate sponsors. We're probably going to, well, not probably, we're going to do the Healthy Counties group this meeting this year, or actually next year, and we just couldn't do it without our sponsors. And you've been so supportive to Healthy Counties and to NACo overall. So 1,000 thank yous to the sponsors. We appreciate your partnership with this board and with all of NACo, to be quite honest. I do want to introduce Nastasia Walsh. She's a NACo's Assistant Program Director for Community Health and Justice. Nastasia is our liaison to Healthy Counties Board. If you need anything, please contact her. She is fabulous and always available and funny and kind and nice and just really good at her job. And so Nastasia, thank you so much. So as I said before, the Healthy Counties leadership, we met last month to discuss the goals for this year. And what we decided is that we would have 4 areas that we would work on, but all 4 areas would sit under the title of social determinants of health. And so what social determinants of health are, why they are important to a healthy county, to a healthy population. Those are all the things we're going to talk about. The 4 areas we decided to focus on this year are the following: mental health and mental and behavioral health and substance dependence, in the age of COVID. Obviously, I'm a mental health therapist. I do not believe we've yet seen the full impacts, the mental health impacts of COVID. I believe we're going to see those impacts really for the next many years, to be quite honest. So that's one of the goals. Food insecurity is another goal. Just talking about food deserts and what healthy eating is, and the fact that somebody can eat and not eat healthy. Somebody can actually be someone who has plenty of calories in them, but still be malnutritioned. The built environment and land use, that's so important. So the environment in which you live so plays a role into your health and the community's health. So built environment's really important. And then aging across the ages. And that's an interesting one, important, because a lot of times I said this to the group, a lot of times when we think of aging, we think of our age and the age we've been. We don't think of the ages we're going to be. And so aging, we saw in COVID how hard COVID hit our older populations. And so we decided to have a special discussion on aging as it relates to all the other topic areas. So we look really very much forward to engaging on these topics, to hearing your thoughts, getting your feedback, talking to us about what you guys are doing every day to improve your communities, to offer a great quality of life in your community. But our programming throughout the next year will be on those top 4 priorities. We also discussed the need for level setting. This is a brand new board with many new people, new leadership in some areas. We want to make sure that we're all speaking a common language. I know as a mental health therapist, I often fall into mental health therapist talk and use lots of acronyms, and people have no idea what I'm talking about. So we want to level set to make sure that as we're here today and at all of our meetings, everyone knows what we're talking about. And to that end, I really, really want to encourage people to ask questions. Never think you can't stop and ask a question. I mean, when I became chair, the amount of times I had to stop our zoning staff and say, what does that acronym mean? I don't know what that means. And so let's make sure we're all speaking the same language. And by doing that, I think we really do promote good health if we're all on the same page. Our meeting today will mostly be focused on the social determinants of health, which are conditions in which people are born, live, grow, age, and those social determinants of health are things like socioeconomic factors, education, physical environment, access to healthcare, access to healthy food, people who may have different abilities, all those types of things. And so we're going to talk to our expert today, and he's going to level set us on what that is, because that's going to be so important for the rest of the year. We want to have a conversation about how county leaders can shape their policy agendas and understand how the social structure can lead to a healthy environment or not, and what we have to do to maximize our social structure to have the healthiest environments. And we are going to begin with a presentation from Dr. Brian Castrucci, who I hope I say your name right. From here on out, I'm calling you Brian. That's the first and last time I'm going to mangle your name. From here on out, it's going to be Brian. Brian was the president and chief executive officer of the Beaumont Foundation, and very important for this conversation and for the past 18 months, maybe a little more than that. He is an award-winning epidemiologist with 10 years experience working in state and local health departments, which is have had such a heavy lift this past year, our state and local health departments. His bio is a lot longer. You can go Google and read about it, but he's asked me not to tell his whole bio because we don't want to know about what he did in middle school. So I'm not going to tell his whole bio. I'm just going to start from here and say, Brian, thank you for for coming to us today, and hand the floor to you.
Great. Thank you so much. It's great to see new faces, but some absolute leaders. I'm a huge fan of Nick's in San Diego, and Carol Morley is genius as a public health practitioner. So there's a great opportunity, and I'm really happy to be here. And so this is really just a quick part about the Beaumont, advancing policies, building partnerships, and strengthening the public health workforce to create communities where everyone can achieve their best possible health. That's our mission. If you're Twitter people, follow me, follow the foundation. There's a lot of work. We basically make tools for people who care about advancing public health. So whether it's the only data set in existence that allows you to compare health department employee perspectives throughout the nation, whether it's we just published an amazing compendium of policies that can help advance racial healing. It's called Healing Through Policy. It was done in collaboration with DeBeaumont, the American Public Health Association, and the National Center for Health Equity. So everyone, you all see these folks who've kind of put out statements, and that's good. That's a good first punch. But then what's the second punch? What's next? Like with California, taking away some of the restrictions on single family housing. So those are the tools that we give out to folks who are all in the business of trying to make the world a better place and our communities healthier. So you'll remember this, and everybody I've talked about social determinants of health can remember this. This is our fish, right? I like fish. I have fish at my house. I used to travel a lot, and so it's good because I just have to feed them every so often, and then the fish don't miss me because they are just fish. And I do everything I possibly can to make my fish healthy, to make my fish happy. I give them the best fish food. I put little things in their fish tank so they can exercise. I make sure that they swim 10 laps every day in each direction. And when fish friends come over, I make sure that they have little fish condoms if they want to engage in fish sex. I do everything to make sure that my fish are healthy. But I got up one day and the fish weren't really looking good. And they weren't happy. And I'm just looking at my fish trying to figure this out. And my son came in and he said, maybe Dad, every so often you need to change the water and clean the tank. But I did everything I possibly could to keep my fish happy. But the environment in which they were living, the rules that I set, the policies I made for my fish tank, neglected the tank and the water. When we talk about social determinants of health, we are talking about the tank and the water. And what's happening all too often is we are quickly medicalizing the social determinants of health. When a hospital comes to you and says, we are showing a return on investment because we've taken on the social determinants of health, they are not being accurate with you. If you are so last night, my fish was hungry. One of my fish, I have 30 fish. One of my fish was hungry and I fed that fish, but the other 29 were still hungry. I didn't do anything to impact the fish tank. So when someone says, oh, we're impacting the social determinants of health because we have a food bank in our hospital, we have a person who's helping individual patients with housing, they are meeting social needs, not social determinants. And if we don't get that right, we won't make people healthier. We will just be on a conveyor belt. Y'all are, when I tell this to my staff, they never understand it because they're all very young. But remember Lucille Ball with the candies? Her and Ethel were trying to pull all the candy. You know what my question was? Why didn't someone just unplug the machine? So when we're dealing with social needs, you are Ethel, you are Lucy, you are just pulling the candies as fast as you can, and sooner or later, there'll just be too many to pull. You've got to work through policy by pulling the plug. So I am always excited to talk to you all because I truly believe this. City councils, county commissions have more influence over our health than physicians or any other healthcare provider. Now, you don't have as much play over my health. That's something I do with my physician. But you have a much larger role to play when it comes to our health, right? think about, this is my favorite thing, when I think about CDC and CDC guidelines around the pandemic, some of the first things they said was, if you're sick, stay at home. Don't go to work. Well, let me tell you, because Phyllis, I got 2 wonderful kids myself. And if it was ever a choice of me going to work sick or those kids not eating, I'm going to work sick. And we've placed far too many people in this nation in that choice because we don't have national paid sick leave. But in one of our projects at De Beaumont called City Health, we've had localities, the city of San Antonio stepped up and they were the first city in the state of Texas to pass Tobacco 21. And then the state followed suit. They also made a law in the city of San Antonio that any employer with 1 or more employees had to offer paid sick leave. What an amazing way to deal with that tank in that water. And so when we entered COVID, we had folks who could stay home and not risk their family's home or their child's hunger. This is how I think of COVID-19. All of us have seen people pass from COVID-19 unnecessarily. COVID might have been the match, but we were stockpiling kindling for a long time, hundreds of years in some cases. 121 consecutive months of economic growth through the end of 2019, but the federal minimum wage did not increase by 1 cent. And one of my favorite things from the 2020 election was that in Florida, the increase in the minimum wage in the great state of Florida outpolled both Biden and Trump by a good 10 points. So if you can pass livable wage in the state of Florida, when we got T21 passed in the state of Texas, then those become bipartisan. Because we spend far too much time debating which side of the aisle public health falls on, instead of realizing that public health is the dirt on which those aisles were built. That we are failing in COVID is that we have been trying to surge on a broken foundation. It's like trying to put up curtains in a house whose foundation is cracked. And so when you look at this graphic, it's all these things that contributed to COVID, and all of these things are our choices, our policies that we've made that allow predatory behaviors. So if we are, I have an apartment and I'm doing great, and then all of a sudden a big employer goes in next to me and my rent quadruples and I can't afford it anymore, that's not on me. That's on us for not providing the appropriate protections for renters in our community. And that's how people then get into poverty and they end up on this stack. So this is from an article that I wrote with John Auerbach, who is now at CDC. He was the president of Trust for America's Health. And it is really trying to differentiate that idea of downstream clinical services, midstream things that we do for individuals in their community, and then really what we're talking about here, which are upstream strategies, laws, policies, regulations that have community impact. And I'm going to break this down a little more detail. So this is because I'm an epidemiologist, so I got to put things in the tables, right? It's how we think. So let's look at the individual side. When clinic-based care, that's downstream. That's what you do at a hospital when you're sick. But then we talk about things, even like our public health, agencies, they do home visiting. Community health workers, you've probably heard a lot about community health workers. Providing food to patients, collecting social determinants data. This is midstream, but it's still individually focused. I had a community health worker tell me about her experience working with a patient who was diabetic and hypertensive and non-compliant and in the ER every couple of days. Huge costs with this patient. She took him bowling. He was lonely. And now he's never in the ER. That's great for him. but it's not social determinants. That's an individual need. And then even when you have like grants and loans for individual housing improvement, that still focuses on the individual. Earned income tax credit, the actor is the individual. Now let's look at that community side. Even there's a such thing as like community downstream, and that's like community-based resources like food banks, Meals on Wheels. It hits a lot of people in the community, but it's still really teetering on that individual versus community line. Dignity Health, which is a health system in the Midwest, also KP, Kaiser Permanente, they have all invested in the development of affordable housing in their footprints. They've put out low-income loans so that people will invest and build affordable housing. Tax credits for the construction of grocery stores. If I was to come to y'all and say, I have a food desert problem, and I'm the local hospital, wouldn't it be amazing if the county said, we're gonna lower taxes on a new grocery store, you hospital, you're gonna put up the capital at a lower interest rate, and we're gonna work together to actually bring a grocery store informed by the community into that area. That's how you solve food insecurity. Food insecurity and solving food insecurity is different than addressing hunger. Hunger is a temporary and transitional state. Food insecurity is persistent. And then ultimately at that community leave, that paid sick leave policy, something that we are promoting at De Beaumont is the paid proactive rental inspection policies, where you go into a home as the city and say, I'm here to check out this apartment or this rental property to make sure it is safe. Because I want to make sure that if we are renting properties in our jurisdictions, that those properties are not making us unhealthy. So I'm gonna I only had so long today. I'm like Captain America on this stuff. I could do this all day, but 2 graphics to just leave you with, because these graphics I think stick in your head. We talk about all this stuff in healthcare, value-based contracting, ACA, all this stuff. All that is just catching the water. The only thing that shuts off the spigot is policy. Medicare for all doesn't make us healthier. It just pays for the care that we need because our society has been constructed to make us unhealthy. In that bill, those candies will keep coming. And that bill will just get bigger and bigger. We need Medicare for all. We need health care. People should have health care. But I want to create communities and environments where they don't need it, where it's not something they have to have. I want to pull the cord out of that machine. And this other one, this is something that people fall into nearly all the time. When we have health problems, we talk about getting the health system more and bigger buckets. And we don't fix the hole in the boat. The hole in the boat is poverty and homelessness. And here's the thing, and this is what's awesome about what you guys get to do. We know how to fix every single social problem we have. We really do. We lack the political will to implement the solutions that we know work. No more research, no more studies on homelessness, no more studies on hunger. The science is there. We know exactly what to do. It is now up to us to do it. So I'm happy to take questions. Look, I'm right on time, that's usually an impossibility. But I hope this starts a conversation where, if I can be useful to y'all, we at De Beaumont want to be. I would strongly encourage you, I'm going to put it in the chat now, to check out our city-based policy work at something called cityhealth.org. I heard some folks from some cities who are going to be in our new expanded city health project, where we will go and we will rate cities as to whether they have certain policies, and we give you medals as to the degree of policies you have. And we work with you to try to help pass policies. And these are not controversial policies. These are mom and apple pie type policies that we all should have, like paid sick leave, like clean indoor air, access to PreK. PreK, my friends, is like having a cure to cancer that we just don't give everybody. The data on PreK is unparalleled. And we as a nation need to figure out, if we want to address disparities in our nation, get every kid access to high quality pre-K, and this nation will thrive. So that's what I got. Happy to take questions, and more than happy to have follow-up conversations with anyone at any time and any place, especially those folks from North Carolina. I'm from Durham. I graduated from NC State. And Nick, anytime you want me to go to San Diego, like, just tell me, because it's San Diego. So happy to take questions.
Well, that was amazing. That was just amazing. And thank you so much. So what we're going to do is, I see some questions in the chat. In fact, quite a few questions in the chat. So we're going to first open it up to people. What I might do is ask some of the questions that I see in the chat, and then people can chime in. So first of all, that was fantastic. And actually, you're not only on time, you're a little early, so you're good.
Okay.
With regards, this is from Brian. I'm sorry, this is from Dwight. With regards to social determinants of health, Brian, are you confident in recommending a specific set of social deterrents? And what indicators would you place a higher value on?
So I think what we've done in our City Health project is we are only advancing policies that have a strong evidence base. Now, it's very hard to tie metrics to this policy gets us this outcome, because there's a lot of confounding that happens at a population level, right? With housing, we know how many people are not housed. We can get people housed. We can follow them. We can look at the healthcare system and figure out how many of those kids or those people used to be hitting the ER that aren't. So when we look at something like City Health, we have gone through both City Health and our Healing Through Policy work. We have gone and done evidence-based reviews of these policies. So these policies have been shown to work. You know, you don't, when your doctor, if you have high blood pressure and your doctor says, I'm going to give you losartan, you don't say, well, can we do a trial on losartan? No, we've already done that. We know it works. That's what these policies are. And these are policies that right now are hitting in a lot of different spaces. And so the trick is it can be overwhelming when you look at a policy package that has, 9 policies, or now we've expanded it to 12, but pick the ones that you think that would work in your community. What's that first step? Do you have clean indoor air policies? Do those clean indoor air policies include the nursing homes and the casinos? Because we talk a lot about health equity, and it's really easy to eliminate smoking in public housing, but it's really hard to do it in the nursing home or the casino, right? That's an equity issue. That's something that we need to be more inclusive in that policy, and to say, nursing homes as well and casinos. How are you sourcing your county contracts with environmentally friendly contractors? Those are questions. That's what's asked in this City Health kind of model. But that's what we've done to try to help you, is we've across several different social determinants, education, housing, food, we have done all the work of finding you the best policies that are out there. And then in each of those policies, we give you what is good, a bronze medal, what is better, a silver, and what is best, a gold. So San Antonio went for the best paid sick leave policy, which is everyone with one employer, and it specifically called out you could use your paid sick leave for domestic violence. Going to silver, it was like 5 or more employees and only this many hours. So we don't make model policies, but we give you the components of what is a good policy. And let me tell you, the City Health people are there for any city, county in the 75 largest in the country to work with them on passing policies. So I hope that's helpful, but that's a really good resource to just kind of click around on. And interestingly, when we started in 2017, only half of the cities that were there, that we just did the 40 largest the first time, less than half actually had 4 policies or more. By 2020, 90% had 4 of the policies or more. And to get a gold medal, you don't need all the policies, because all the policies don't work for everybody, right? You may not have a housing crisis that you need affordable housing and housing trusts. That might not be your thing. So it's a very flexible package, but to get us all down the road. The website is City Health, just CITYHEALTH.org. We
So
like
Brian,
simple rules.
so Brian, let's talk a little bit about something you just talked about. You know, that graphic was amazing on COVID and the fact that COVID lights the fuse, but it shows us everything that was an issue already. And I think in some ways we all knew this, and COVID just tore apart any drapes that was over it and just said, this is what it is. And so it had a very real impact on our communities as far as equity issues. So how have our priorities, or should our priorities change because of COVID? And how do we start getting back toward recovery, but not recovery to get where we were, recovery to go to a different place? If we've changed the priorities post-COVID, what do we do now to get one past COVID, but then to a better place? Because I know there's a lot in that question, but that's my question.
So we got to start by looking at our individual communities and our data and who was hardest hit, and then try to figure out what our hand was in creating policy environments and community environments where people couldn't thrive. Now, it's super unfortunate that we've had very limited data when it comes to COVID. We do have some race data, but I want race, I want income, I want occupation. Because I think just looking at through one singular lens obfuscates the true story.
Yeah.
And we worked with the Utz potato chip factory through our Health Action Alliance, which engages businesses. And as I'm sitting there, we closed in March of 20, and we have not opened again at Beaumont. But guess what? Utz never closed, right? It's one, we got to build a lot of resiliency in our community. There were any number of places throughout this nation where the health commissioner met the Chamber of Commerce president for the first time. They said, hi, Bill. They said, hi, Jane. Hey, Jane, I'm doing a stay-at-home order and I'm shutting everything down. That's a bad first date. We have to make sure that government has the trust and credibility so that people will listen to what we have to say. This epidemic of misinformation is an immediate threat to our health as a nation. This misinformation that is being proliferated on social media outlets is like a gas leak. And if there was a gas leak in your community, you would call the gas company and you would stop the leak. When you look at people who get their news from local officials versus newspapers versus social media, it is about a 12 percentage point drop in vaccination for social media.
Wow.
Social media has some of those people who use social media as their most frequent source of news have the highest rates of misinformation out of any group. And
Wow.
You know who has some of the most misinformation about COVID? Those people who share posts on social media daily. This is a problem. And so we have to engage the community better, bring them in, start talking about how do we construct a community where everyone does have their chance to achieve their best health. And this might mean paid sick leave. This might mean more than PreK. We talk a lot about equity, but a lot of our equity problems, they're baked in with the data we collect. And we're just as guilty of this. All of our COVID messaging is based on 1,200 person national random samples. So any nuance, like I grew up in North Carolina, right? And my parents, they said, they were Republicans. And I was like, okay, this is interesting. And then I moved to North Carolina. And my parents were like, no, that's not what we are. Like, that's very different. And it's because everyone has a nuance. We are a nuanced country. And this push to polling and national data, I don't care if we get to 90% vaccination rate in this country, that does not protect you if the vaccination rate in your county is 40%. Right? That 90% is not, you don't confer that protection. So we have to talk about, paid sick leave, affordable housing. Right now, eviction is all of a sudden a hot issue. Y'all know that eviction was an issue before COVID, just no one cared. It just wasn't, it didn't threaten any of us. Now it's like, well, if we have a lot of people evicted, it might spike COVID. We might have to close stores and close schools. And you're like, oh, I don't want to do that. So we should really look at eviction. Do you have one of the policies in our new policy package legal representation for renters. So here's a renter who's trying to go up against a property owner. Property owner has all the resources in the world. And I'll tell you a personal story. When we moved from Atlanta to DC, we rented. And all of a sudden, after we had rented for a while, there was a hole in my kitchen floor, like a literal hole. And I called the landlord and I said, I got a hole in my kitchen floor. He goes, not my problem. Aesthetics are not my problem. And I said, well, I'm gonna sue you. He said, I don't care. I have a bunch of lawyers. And I said, well, I'm going to stop paying rent. He said, that's fine. That's what those whole bunch of lawyers are for. Let me be super clear. I am a well-off, straight white guy. I am the picture of privilege. And in that moment, I was gutted. The only thing I could do is I could have paid out my entire lease and left. Until the city of Rockville knocked on my door and they said, hey, we're here to do a rental inspection. I'm like, why? And they said, well, this is the policy. And I showed him the hole and he was like, that's a hole. And the next day it was fixed.
Yeah.
That's what you guys can do.
Yeah.
That's
yeah.
the power that you guys have.
Yeah. Yeah. I could not agree more. I think it's I can see other pictures of my county's colleagues. It's why we like the positions, why we wanted to serve in this way, because we know that local government has the most impact and can do the most good, to be honest. It's not because of the pay. And it's definitely not because of the thank yous, especially this year, right? It's because of what we can actually do. Let me ask you, we talk about equity a lot, and it's all of a sudden became the thing we talk about. And for me, when I think of equity, yes, I'm a woman and obviously I'm a Black woman, but equity goes beyond just my gender or my color. Equity is also equity of age, equity of differing or different abilities, equity of experiences, equity of education. Equity is a big word when you kind of fan out and look at the whole discussion. So how do you know that equitable policies we might be putting in place are actually helping with those social determinants of health? How do you know? And because as a therapist, and I have to focus on evidence-based therapy. I have to do, commitment to care from our trauma-informed care, or I have to go with statin seminar or somebody who's an evidence-based provider. You can't just choose any curriculum or any theory out the air and go with it. I have to use seeking safety, or I have to be able to prove that what I'm doing has results. So how do we know when we're talking about equity as a priority for healthy counties and practicing social determinants of health? What are the evidence-based ways to know that?
Yeah, I mean, I think, again, it's the evidence. There is plenty of evidence. To take aging, for example, where people know that if you have building codes that are pro living in place, that are aging appropriate, then you will lower falls, you will lower hospitalizations, you will lower death among your elderly. All of these, and again, it's going into, and it's really, what I encourage all of you to do is start a social determinants kind of council, right? Like, Nick does this in San Diego, where all the people come together, right? You have a lot of good collaboration amongst your city agencies. And it's like transportation, you shouldn't go talk to the transportation people, then go talk to the health people, then go talk to the police people. It's all the same thing. See, all of our problems originate from poverty, lack of education, barriers that we've erected systemically that limit people really in all of our country, where everyone does not get to achieve their full self. We need to work holistically across all those groups. Let your health department deliver that evidence, right? That's that kind of, evidence in all policies instead of health in all policies, evidence in all policies. Yeah. Things like we know that health impact assessments work when it comes to new building and new projects. There's now increasing discussion of race assessments, racial impact assessments, like show me the demographics of who that new road's going to displace. You said it was only going to be 100 people, but you didn't tell me it was going to be 95 people of color and 5 white folk. That's a problem. I don't know that I want to put the road there. But It's the evidence, and that's where the health department has to lead in looking in that holistic health lens, gathering that evidence, because God knows we have enough peer-reviewed articles to like form a whole nother planet in the solar system, but no one is translating that information into action. But that's where our health department leaders need to be working. They need to be telling you these are the policies that work. So when someone says to you, oh, let's do this policy, the first question should be, is there any evidence that it works?
Yeah.
Right?
Yeah.
Would you like to take something that a doctor prescribed to you, or would you like to take a vitamin that you bought on the street? You know, take the prescription. Policy, evidence-based policy is a prescription for your community. And
So
it'll help.
we have two more questions.
That'll help. Yeah.
Somebody is asking, you mentioned, well, actually, we have a couple more questions, actually. Somebody is asking, you mentioned that PreK is kind of the magic pill to answer a lot of our social, what ails us socially. Can you expand on that?
The data are abundantly clear that if children have access to early education that is of high quality, now this is not necessarily childcare, right? There's a difference. This isn't just dropping somebody off at grandma's house and running around. This is early care and learning. And if you can get more kids engaged in early care and learning, it takes a burden off of mom because she gets to go back to work, typically mom. The kids are getting all this information. Let me tell you where it hit me. So my kids who were in an early care and learning center from age 2, when they got to kindergarten, they were already starting to read. They knew all their letters. But those kids who this was the very first time that they had sat in a classroom, they didn't know their letters. They didn't know how to read. And you all of a sudden, in like plain sight, you saw how we bake disparities in during the 2 to 5 year age period. And if you have early care and learning, if you get folks into high quality pre-K centers, then that word gap that has been documented at age 5, that gap starts to go away. If you look at some of the really good studies that have followed kids, incarceration is down, third grade reading levels up. Like all of the really good outcomes are there. So again, we know that access to early pre-K, universal access to high quality pre-K would be, and again, I think that's something that I don't think it matters what party you're from. I think we want kids healthy and happy and learning. So we got to put the investment in to getting those kids into that high quality pre-K, subsidizing the cost of it because it is expensive, but then we'll get the money back in less demand for social service, or keeping people in our communities so that they can be the workforce, and you can then attract more businesses because you have a solid workforce for the future. That's how you're building that workforce. So that pre-K, and it's one of our city health policies, it is super important and high quality. Absolutely. Right? And that's the hardest part, because you need, I know for some of the requirements, for some of the accreditations, you need someone with a BA leading that teaching in those early learning centers. That can be challenging, giving the pay. But you can look at GEARS, GEEARS in Atlanta. Arthur Blank's ex-wife, the owner of the Falcons, she started that group in Atlanta, and they've been working with their state's Department of Early Care and Learning to really build Georgia's future. Georgia's future is built on the children and their learning. And that's how we build our country. That's how we build our country to wherever we want it to be. That's why I think pre-K is essentially like having a cure for cancer that we just don't give people. We've decided it's too expensive.
Absolutely amazing. So last question. You are the only person, you and Nastasia and Alana, only person on the call who are not politicians. Yeah. So good or bad. So this is a harder question. Sometimes, and I'm looking at my Healthy Counties peers, when we start talking about these things, what people hear is subsidies, what people hear is giveaways, what people hear is, that type of stuff. I remember being at a town hall and talking about the importance of affordable, accessible housing. And a man stood up and said, if you put affordable housing in my community, I want everyone to have a urine test, a drug test, and a background check. And it just, it just took my breath away. And of course, I'm a, elected official. I can't say, well, that's just the most ridiculous thing I ever heard in my life, because I want to remain an elected official. But I was thinking it and I thought, you've got to be kidding. And so talking to a group of local elected officials who meet our constituents in the grocery store and on the walking path and at church and, at the daycare, what do you think are some of the best tools that we can use to engage our communities that would help them understand why we have to provide those opportunities and housing opportunities and healthy food opportunities and job opportunities? How do we communicate with this that hits the ears of constituents in a way that can be digestible for them?
So I have an unsatisfactory answer, but I'm going to put a down payment down. We in City Health, we just did an entire messaging assessment for every one of our policies, for conservatives, for liberals, for all different people. Now, this thing is stinking amazing, but it's only for internal use. And I'm
that's not helpful at all. That doesn't help me at all.
I'm having a real challenge with my team because I'm like, this is gold. And I can't. So we're going to work on how to start. One of the things we're going to do, I think in 22, is start talking about how we message, right? How we message things, because I don't believe we are as polarized as the media would have us think about it. I think that dude who wanted the urine test, I think he's a really vocal, but part of a really small minority. And every time I got interviewed around COVID and they'd say, Republicans don't want to have the vaccine, I would stop them. I would say, go to our website. I have PSAs that were recorded by 13 physicians and pharmacists who all happen to be GOP members of Congress. And all of them said, and this was in May, I took the vaccine. I think you should take the vaccine. It is your choice. But I was like, why are you not putting Brad Wenstrup and Marionette Miller Meeks on? No, you want to put, Marjorie Taylor Greene and Matt Gaetz, because you're here for a media narrative. So I think we got to talk to the reasonable people. And I still really believe that most Americans are reasonable and they want to live good lives and they don't want to truncate anyone else's ability to have a great life. And we got to help them understand that when one of us is held back from achieving our best selves, we all lose.
Yeah.
That could be the next great idea that we just don't get.
Yeah.
Right. And when I have conversations with people and they say things, if you go into an inner city school and, those kids just don't want to learn. I'm like, that's not true. That's kind of bullshit. Now, I'm not a politician, so I can say that. So, and it's really, it's like, let's look at what kind of schools. Let's look at what it's about. Let's look at how we're funding schools. Let's have conversations, and I think the best thing I think to read, if you've not read The Sum of Us by Heather McGhee, it's a beautiful book about why when any one of us is held back, we are all held back. And this isn't a zero-sum game. I'm not saying that, some like my kids are going to get less math,
right,
so that another kid can get more math.
Yeah.
My kids are going to get math and your kids are going to get math.
Yeah.
And so this kind of framing of, just having like one piece of bread that we got to split up, we got a loaf.
Right. Yeah.
And so we really want to help politicians, and we'll reach out to NACo on this as we start to do this. But we want to talk about how do we frame and talk about policies. And this is what we did. One of de Beaumont's claims to fame is that we went into conservative and Republican groups around COVID messaging. While everybody else, like, we don't have a whole lot of money, and that was a place that no one else was. We worked with You all might know the pollster Frank Luntz.
Mhm.
Frank and I worked very closely on messaging about the vaccine to Republican groups,
Mhm.
and did it, listen, and where I'm not a politician, but right, the fringe Republican media has called me any number of things in op-eds because not everyone was going to be down with it. But I think there are a lot of people on both sides of the aisle who realize that a strong America is united. What breaks my heart is that never in the history of this nation have I seen us confront challenge by dividing.
Yeah.
Like if Pearl Harbor happened today, half the people would be saying it's fake news.
Right.
Germany's not a threat. Like we could
Yeah.
not win World War II today. Right. And I mean, fortunately, the founding fathers put defense under the federal government, but this is the problem with health. Health is a federated system.
Yeah.
And it's every one of us and every one of our governors making individual choices about a common threat, but somehow coming to different, places. And so,
well, that you are just amazing. And the good news is you just live down, like you don't live that far from me. We can get together for lunch. You're just you're across the river from me. We can get together and talk anytime. This was fantastic.
Phyllis, I will steal the internal document and I will slip it to you.
And none of the Healthy Counties people would ever tell. They would never tell. That's who we are. That's how the Healthy Counties Advisory Committee roll. That's how we roll. Us to know it. It's amazing, amazing. Well, listen, Brian, thank you so much. I could do this. I could do this all day, and believe me that the one thing about, and I say this all the time about local elected officials, especially the Healthy Counties people, is at our base. We may look good, but we're really all just big nerds. And all we want to do is talk about this stuff so we can figure out the issues and fix it. And so, you've got the right group to talk about it all day with us. And so thank you so much. I really, really do appreciate you being here and cannot wait to see you and talk to you in person. And Nastasia and Alana, we have to talk to him about what we're doing next year in North Carolina and see if we can maybe join. You can maybe join us at that time. So thank you. I'm going to have just a couple of next steps, a few announcements before we get ready to sign off. We're going to have a every other month meeting for the whole Healthy Counties Advisory Committee. What we'll do is for 1 month, it would just be leadership, and the next month it would be everyone. And so that's how we're going to do that. So our next meeting for everyone will be held December 15th at 2 p.m. Registration is open right now on the NACo website, and an agenda will be forthcoming. We will also start up, and we're sending out the Healthy Counties newsletter. Hopefully you all have received your first Healthy Counties newsletter. So to be sure to send updates on your county initiatives. And what we're doing is we're having all the vice chairs kind of be spotlighted and highlighted in the Healthy Counties newsletter. And so every newsletter you'll meet a different vice chair and talk about what they're doing in their counties. So that's going to be really kind of exciting. Health Smart, Healthy Counties is a sponsor, and NetSmart, is hosting a webinar on November 14th at 4 p.m. on advancing the patient experience. Information sharing with health systems is going to be part of that webinar. It's going to be pretty fun. So if you can get on NetSmart, and your county peers will review basic building blocks to to patient engagement and show how far reaching they are into all aspects of your organizations. And registration for that webinar is now open. And so thank you, NetSmart, for doing that. And it's open on the NACo website. And we are so excited, and I don't know if Sig had to drop off, but we are so excited that we are actually going to have a Healthy Counties Forum this year or next year in North Carolina, in Wake County, North Carolina. I know Sig has been talking about doing this for a long time, and he has been thinking about it and planning it. And so we are really excited about that. The forum will give us opportunity to connect with each other personally, one-on-one, to see that in real life, I look a lot more like Halle Berry than I do over the video. So you'll see that when you see me in person. We're going to talk about how we can help our residents and ourselves kind of get through the COVID pandemic. Hopefully by then we'll be through the Delta variant and there will be no more variants coming up. We're going to announce the date by the end of the year, but it will be in Wake County, North Carolina. So everyone be looking for it, be planning to meet us there. We are so excited about doing that. And I want to say thank you to our sponsors for that. Thank you to the NACo board, I'm sorry, NACo staff, but thank you to SIG especially, who's been kind of pushing this and wanting us to do this for a really long time. So we're gonna get it together. And lastly, I'd like to plug NACo's United Stories campaign, which will highlight counties' critical roles in the front line of COVID. You know, it's been interesting because it is often the state and elected officials who kind of take all the bows when it comes to what's happening in COVID. But we know it's been counties who figured out how to get PPE, and it's been counties that's been rushing staff over to the nursing facilities, and it's been counties that's been setting up first testing and then the vaccination sites. And so we've done so much. So the campaign will tell the full story of county's efforts and the incredible difference that county elected officials have made in residents throughout the past year from the American Rescue Plan Act. So you can join this effort by submitting your story on NACo's website at naco.org/untold stories. Again, naco.org/untold stories. And there will be templates there, a media relations guide, as well as resources to engage your residents for them to share their own untold stories. So that's the NACo's new Untold Stories campaign for local elected officials. So that's really very, very exciting and really important. So before we close, I'm going to turn it back over to Nastasia real quick to say anything she wants to say, and thank her for all that she's done. Thank Alana for all that she's done. To the vice chairs, good job, everyone. This is going to be a great year, and looking forward to see everyone's kind of introduce yourself in our newsletter. So all the vice chairs, thank you so much. Stay safe, everyone. Please stay safe. So we can join us in North Carolina. I'm going to pass it back over to you, Nastasia, to say any last words before we sign off.
Great. Thank you so much, Chair Randall. And thank you, Brian, for the discussion. Really interesting, some great metaphors and analogies that folks are talking about, and just really appreciate everybody for joining today and for this discussion. I will be sending out the recording and the slides for this meeting and some of the links from the chat out in an email later this week. So keep an eye out for that. And if you want to be on the Healthy Counties newsletter and you didn't get it a couple of weeks ago, just shoot me an email and I'll get you on there. So thanks everybody for joining. We'll see you on the next webinar on December 15th. And Chair Randall, anything else from you to close us out?
I have nothing else. Just want to thank everybody. Tell everyone to stay safe. When we see you again, we'll be smack in the middle of the holidays. So have a great Thanksgiving, and we'll see you guys in December. And vice chairs, we'll see you next month. All right. Bye-bye.